When we think about getting cosmetic work done, our minds usually jump to things like skin, or maybe hair, or teeth whitening. But what if one of the biggest frontiers in aesthetics is a place we almost never talk about? Okay, let's dive into this.
So let me ask you a question. What's the very first thing that pops into your head when I say a perfect smile? Go on, think about it for a sec. I'm willing to bet you're thinking about teeth, right? Bright, white, perfectly straight teeth. That's what we all focus on. It's kind of the obvious answer. But it turns out there's more to the story. Researchers are looking a lot closer these days, and they're focused on the frame for your teeth, your gums. It plays this huge role in how we see a smile. And for a lot of people, the color isn't that light pink you see in commercials.
So let's kick things off by really digging into why this, hidden detail is suddenly becoming such a big deal in the world of cosmetic dentistry.
And this isn't just some tiny, minor thing. Researchers say it has, and I'm quoting here, a profound influence on the perception of an ideal smile. So we're talking about something that can totally change how a smile looks and feels. It's a critical part of the whole picture.
The official name for this condition is gingival hyperpigmentation, and all that really means is there's an overproduction of melanin in the gum tissue. Melanin, that's the same stuff that gives color to our skin and hair. It's totally harmless, but for a lot of people, it's a cosmetic issue they'd really like to fix.
Okay, so if you have it, how do you treat it? For a long time, the options were, pretty invasive. But luckily, technology has given us a much, much more elegant solution.
The history here is actually pretty wild. We've gone from literally cutting away the pigmented tissue with scalpels, yikes, to trying things like cryosurgery or even chemicals. But the modern era, it belongs to the laser. It's become super popular because it's precise, it works, and it means way less bleeding and pain for the patient.
But get this, here's where it gets really interesting. Even in the world of lasers, there's not just one way to do things. A recent study decided to put two very different laser techniques head-to-head in a kind of face-off. To wrap your head around this, think of it like this. The ablative technique is like a power washer. It physically blasts away, or ablates, that super thin top layer of pigmented gum. The non-ablative technique, on the other hand, is more like a sniper. It uses a very specific kind of light to zap the melanin under the surface, messing up the pigment without actually removing any tissue. And as you can probably guess, these totally different approaches lead to totally different experiences for the patient. The ablative method, it needs local anesthesia, and the laser actually touches the gum. But the non-ablative method is so gentle, it often doesn't need any anesthesia at all. It's done from a little distance, and it uses a cool water and air spray to keep everything comfortable.
So, which one is better? That's the million-dollar question, right? To find out, researchers came up with a brilliantly simple experiment.
They used what's called a split mouth design, which is just super clever. They took 20 patients, and each person basically became their own control group. One side of their mouth got the ablative powerhouse treatment, and the other side got the non-ablative gentle touch. And how did they decide which side got which? A simple coin flip. This is a fantastic way to compare two things because it gets rid of all the variables you'd have between different people.
And we have to give a shout out to the person behind this clever setup. Professor Walid Al-Tayeb was the mastermind here. He not only designed the whole study, but was also hands-on with the procedures and gathering all the data.
So, with the experiment all set up, the researchers just had to sit back and collect data for a full year. And the results? Well, they tell this fascinating story about a classic trade-off.
Now check this out. This chart really says it all when it comes to the patient's experience. During the procedure, a whopping 55% of patients felt anxious with the ablative technique. But for the non-ablative side, just 10%. That is a massive, massive difference in how comfortable people felt.
And that wasn't all. Patients also had way more swelling in the week after the ablative procedure. So when it comes to comfort and recovery, the gentle touch method was the hands-down winner. No contest.
But, and this is a big but, there's a trade-off. When the researchers checked back in a year later, a completely different story started to unfold. Turns out, 20% of the ablative patients saw some of that pigment come back. But for the more comfortable non-ablative treatment, that number jumped to 30%.
So, what does that mean? It means that the gentler, more comfortable journey came with a price. The results just weren't as long-lasting. The pigment was simply more likely to make a comeback. And that brings us to this final, really important number, 1.
Just one. That's how many sessions the powerhouse ablative technique needed to get the job done. The non-ablative technique, on the other hand, often meant patients had to come back for more sessions to get the same result, which adds more time and, of course, more cost.
So after all that data, which technique is actually better? Well, the study's conclusion is pretty interesting. They basically say there is no single winner. The best choice really comes down to what the patient wants.
And this really is the bottom line. It all depends on your personal priorities. If you want the most effective, longest-lasting result you can get in a single visit, and you don't mind a bit more discomfort, then the ablative technique is probably for you. But if your main priority is minimal pain, no anxiety, and a super quick recovery, even if it means the pigment might come back or you'll need another session, then the non-ablative route is clearly the better choice.
And this boils down to a question that's about way more than just gum color. It's really about how you approach your own health and well-being. What do you value more, the destination or the journey? The perfect result right now, or the most comfortable path to get there? Definitely something to think about.